Let's begin by asking each panelist to briefly introduce yourselves and share one thing that they wish more people would understand about pregnancy and addiction.
So I'll start. Hello, everyone. I am Candace. I'm the clinical integration manager at Urban Baby Beginnings. I'm also a certified doula. I'm a community doula, so I get the opportunity to serve all moms in our community, including moms experiencing recovery. One thing I wish that everyone knows about recovery is it is a process that requires support. It's a lifelong process. It's not a one and done, doesn't make anyone bad, but it just requires an additional support from all of us.
Hi, my name is Rachel Woods. I'm in recovery. I just picked up 4 years on May 1st. And I guess I wish people knew that how much of a struggle it is. I know people think, why can't you just stop? Or there's also so much stigma involved. I feel like if that wasn't as much, maybe people wouldn't be so scared to ask for help. But once you past like a certain point, it's like the point of no return. Like you can't. I couldn't stop without help. It's really hard, but it's not impossible if you have help. I mean, yeah. That's all.
Hi, I'm Kaylee Owen. I'm a licensed clinical social worker and also a certified substance abuse counselor. I work with VCU Health with the OB Motivate Clinic. We treat pregnant and postpartum women with substance use disorders in an interdisciplinary team. What I wish more people realized about substance use and pregnancy is that a lot of the systems that are set up to treat pregnancy and a lot of the systems that are set up to treat substance use don't interact with each other. And there are many barriers when people do want help and do want assistance and they're pregnant. Recovery houses not accepting pregnant women, residential programs not accepting pregnant women, people not wanting to prescribe medications to pregnant women. So when people want help, we need to have systems that allow them to get that help.
Yes.
Hi, everyone. My name is Sonia Del Tredici. I'm a general internist, primary care doctor, and I do some work with complex pregnancy issues, medical issues in pregnancy, and I work with substance use disorder. I take care of any number of pregnant women in my primary care addiction clinic. And the one thing I want people to know, especially if you're clinical, is that working with pregnant people with substance use disorder is awesome. It is fun. It is successful. You actually will have a great time doing that care. A lot of people are kind of scared of it. They're scared of pregnant people. They're like, ooh, I don't know. I don't want to screw it up. Don't want to touch these people. I'm going to step back from it. But I encourage everybody to step towards this care because it's some of the most fun and interesting care and also most successful because a lot of pregnant people are real motivated for change and it's a little sad. They'll do it for the fetus. They'll do it for the baby. They will not do it for themselves, which is sad, but also it's a fabulous opportunity to get people to make some of these changes they've been wanting to make but haven't been able to.
So I'm Jan Brown, and many of you met me yesterday. I'm going to give two. Okay, good. So the first one is there is no such thing as a baby born addicted. I want everyone to know that. Babies can be born substance exposed. They can be born substance dependent, but there is no such thing as an addicted baby. So that's number one. Number two is that dads and fathers need to be part of this conversation as well. We had the good fortune of working with a dad. There is no treatment center in Virginia that will allow a dad to stay with his infant or with his child. So we have a lot of advocacy work to do.
Yeah, y'all started off real strong. Yes. Okay. So let's start with, tell us more about your relationship to recovery, whether you're a person in recovery, recovery ally, professional who works in a recovery space or with addiction medicine. Just want to know a little bit more about like what your primary duties and functions are. as it relates to your recovery?
I consider myself an ally in recovery, being in the community, serving moms in the community. Oftentimes I find that some of our moms in recovery try to be hidden during pregnancy. So they're not attending their OB support, they're not attending, things that are available to them. So as a community doula, my job is to try to encourage them, hold their hand, walk alongside them while they get the support that they need so that they can get the care they need for themselves as well as their babies.
I identify as a person in long-term recovery. The first meeting I actually went to was my mom was in recovery when I was a kid, so I was exposed to the recovery community at a very early age. Unfortunately, my mom is in active addiction right now, and I'm working to become a peer support specialist. My best friend of 20 years relapsed and overdosed in March and died, so I just want to prevent somebody else, save somebody or prevent somebody else's family from finding them like that.
I am an ally and a person who works in the recovery space, supporting the pregnant and postpartum women. We don't have a time limit for postpartum, so some programs are like, oh, you're a year postpartum, you no longer get services. We have patients who haven't had a baby in 5 years, and they will continue to be our patients as long as they would like our help and assistance. Also have a family member in active addiction and have lost, friends over the years from addiction as well. I used to work for Richmond CASA, which is a court-appointed special advocates, and I was seeing mothers who were working through their addiction and babies being removed from their care, and realized that I wanted to get on the other side of that pipeline, and I wanted to intervene during the pregnancy or prior to the pregnancy to help these mothers so that they could maintain their families and get the care that they really needed before it would get to the child services piece.
Thank you. So I would also put myself as an ally, a professional who works with pregnant people in recovery and pregnant people who are actively continuing to use illicit substances. And it's, it feels a little bit selfish. Like, I love doing this work. It's just like so fun. It's so much fun. I can't, I feel like it's no sacrifice at all. It's actually a lot more fun than a lot of the work we do. And I just love helping people in that time of their life.
So I'm a person in recovery. I've been in recovery for 38 years. I I'm a new mom. I have a 2- and 3-year-old, so I am now parenting at the intersection of being a person in recovery and being a parent. Through my work, I do a tremendous amount of peer providing education, so peers who are supporting pregnant and parenting people, curriculum development. I work with Sesame Street. I do a tremendous amount of work in curriculum development and with working with children and youth who are growing up in households with addiction. I work with child protective services, child welfare. For me, one of my passions is working with kinship families and folks who are raising children in the foster care system, because that just happened to be where our kids came from. And so providing them with education and support, knowing a little bit about what they're going through, and I'll answer more questions.
Well, you kind of, touched on some things that are actually in the next question I wanted to ask. So, what has been, and this is for everyone, if you have experience with pregnancy or parenting, and you'd like to share that lived experience, what has that been like for you? And if you have not had experience with this, what is your experience with supporting folks that have this identity personally and professionally? And I kind of want to add a little bit to that. How has it affected your work? That personal experience, how has that affected the work that you do professionally?
So I do have quite a bit experience pregnancy as well as parenting. I have 3 angel babies, and then I also have 3 live children. I I've successfully parented them until their 20s. My baby just turned 20 last month, so that has been a journey. Um, Professionally, I get the opportunity every day to work with pregnant moms and their babies up until age 2 at our maternal health hubs. Our maternal health hubs are perinatal safe spots for moms and families to come in. They receive education. We do parent education. We do home visiting support. We do doula support. And I also run a monthly social support group called Sisters Keepers, where moms can come in, connect with other members of their community, and just get some additional support from each other and uplift each other. What was that part?
You kind of answered it a little bit, like how it has affected your work, being a parent.
Being a parent definitely has affected my passion for this work. As I said, I have 3 angel babies, so I had 3 losses. Some of my losses I felt were a part of medical neglect. I felt like as a woman, especially I was younger, single mother, Black woman, I wasn't respected and heard in the birthing space when I was saying something was wrong. I didn't know how to advocate for myself. I didn't know what to expect. So that fuels my passion to work with moms to let them know, hey, this is your body, this is your experience. You can have the birth your way, the way that you want it. So that definitely inspires me to continue to support moms in all avenues of their life.
I've had a lot of experience with pregnancy and parenting. My journey with pregnancy and addiction is complex and deeply personal. During my very first pregnancy, I stopped using everything except for marijuana, largely influenced by my mom's experience using marijuana while she was pregnant with me. My next pregnancy, I only used marijuana and occasionally my mom's diet pills. I was living with my mom when I delivered my second child. She had just re-entered the recovery community and was trying to force me to be sober. I was pretty much just drinking and smoking marijuana, and she evicted me, and long story short, I ended up losing custody of my children, and I tried to get them back, but it didn't work out. And then after that, it was bad. I started taking pills just to, go to work and not cry. And then I had a traumatic experience. I didn't have anywhere to stay. I was in a Christian program. I found out I was pregnant, and I didn't want to go along with the pregnancy, but they didn't allow abortions there, so they hooked me up with a adoption agency, and I went full term and gave the baby up for adoption. I wish I could say I stayed sober during the whole pregnancy, but I didn't. I was mad that I was pregnant and the whole situation. And then a year later, I got pregnant again, and I got on the methadone clinic. I was on the methadone clinic for the entire pregnancy. Unfortunately, my son's dad has a lot of psychological issues, so due to addiction and several other reasons, I lost custody of him too. My youngest daughter is 5. She was born while I was taking Suboxone. I was in active addiction when I found out I was pregnant with her, and then I got on Suboxone. I actually I was on the run from probation. I turned myself into jail so that I knew that if I went there that I wouldn't use anything, and I was there for several months, and then I went to rehab after that, and I relapsed once after that, but I stayed clean for a long time, and she's right. Having a child or somebody that you have to be responsible for is a huge motivation to stay clean.
I've had 2 children. I have a 10-year-old and an 8-year-old. And I also volunteered as a doula prior to my pregnancies, and I think all of that feeds into the work that I do and why it's so important to me. I also co-facilitate a postpartum depression and anxiety group. I did have some struggles after my second child was born. I know how isolating parenting can be, which is Interesting because it's universal. There are so many people who are parenting, and yet you can feel so isolated and so alone, and like you're doing everything wrong. So I feel like having those experiences helps me show up for my patients and be more understanding to the unique struggles that they have.
So I've also gone through 2 pregnancies, but they're 16 and 19 now, so it's like a long time ago. It's faded into the distance. And my personal experience with pregnancy has informed, some of the work that I do. But honestly, the most that informs most of my work is working with my patients. I think doctors, at least, are very comfortable treating diseases that we personally don't have. Like if you could only have a doctor who had your same disease, it would be very hard to get care. And I try not to assume that my experience is the same as the experience that my patients are going through. So I do tend to just keep my experience as mine, and I have learned so much more about the variety of pregnancy experiences from all the patients I've gotten to work with. So I would just say the patients themselves inform my care rather than so much my own personal experience.
So I knew nothing about being pregnant. I knew nothing about being a parent. I think for me, the piece that's been so significant is that I have a lot of resources, and I have access to resources. I have a lot of knowledge and all of those things, and it's still really hard. So I think that really informs my work, wanting people to have access to the services and supports that they need. And so being able to advocate for those things for other people is very important to me. We do a lot of work. We have and I don't know if it's 800 number, some kind of phone number for moms who are either using or in recovery that they can call to receive support. We also have recently started a Moms in Recovery meeting, a recovery meeting, and so they're teaching me a lot. One of the things that they've recently taught me, which again is an area for advocacy, is around having C-sections and the pain management that doesn't take place for these moms who are in recovery. So that's a place where we're starting to do some advocacy work.
Thank you. And I just want to share really quickly as well. I'm a parent. My recovery gave me my 3 children. One is 6, one is almost 4, and one is 1, just turned 1. I had very different experiences with each pregnancy, labor and delivery, and postpartum. And my recovery, being in recovery, had a lot to do with it. There were some, but I had the unfortunate experience of being a woman of color in the medical setting and not being heard, not being supported, and it became like a medical emergency. And that was when I finally got people's attention that things were wrong and things needed to kind of happen pretty quickly to get me and my son in a safe place. The way that my substance use recovery kind of showed up was I am very open in any medical setting about my recovery journey and being in recovery. That's just something that I have to do for myself to hold myself accountable. And so I will say things, to the effect of, I need to talk about different pain management options. I'm not really interested in anything that's habit forming or what have you. And I like to be open about ways that I'm activated in things. But finding out on the tail end that my son was drug tested without my permission when he was in the NICU, because I was open about my recovery status, did not feel great. Only being offered pain medication that was like opiates after having a C-section, even after I had said, I don't want them. but they're saying this is a standard practice and you're not going home with them. Like they're saying they're giving me those things, even though I've told them, like I'm in recovery and I hold that very high and I don't want anything that's gonna jeopardize that, you know? And this is not to say that the medical community does not get it right, because they do, but I am very real about my experience and my story, and just like these wonderful women up here that are also being very real. That's just a little bit of my experience, so, yeah, of course. Okay, so let's talk about the medical community. What is something you wish people knew about in terms of treatment for SUD and pregnancy? What services have you seen be the most effective? Want me to start? Please.
Yeah, I mean, I guess the one thing to know about SUD and pregnancy is that, like Reverend Jan said, the baby is not addicted. Addiction is a disease of consequences of substance use, and the fetus in the womb doesn't know if the chemical it's being exposed to is legal or illegal, whether it was gotten under stressful or normal circumstances. It just responds to the chemical. And most of the harm we see to actual pregnancies is from legal substances, prescription medications, alcohol, tobacco, and in many states, cannabis. That's where we see the bulk of fetal harm. The illegal drugs, methamphetamine, cocaine, illegal opioids, actually have a lot less fetal harm, but they cause a lot more maternal harm because of their illegality. The bulk of the harm to the pregnant person is because of the consequences of illegalness and the sort of participation in the illegal drug economy, not because of the chemical itself. We need to just ramp that rhetoric way down. The fetuses are resilient, they're strong. Often they're totally fine or need only minimal intervention after birth for a little bit of withdrawal from whatever. Like the fetus will go through nicotine withdrawal, SSRI withdrawal, insulin withdrawal, I don't know, antacid withdrawal, like everything the mom takes when the fetus comes out, it no longer has it and it will have some biochemical withdrawal. So we really gotta like just reduce the temperature in the room, view it as a medical and usually not very significant medical problem, and then help the pregnant person with their sort of keeping themselves stable. And usually that's not so much a chemical problem, it's a legal and social problem. So I really wish that people would view substance use in pregnancy through that lens rather than this just incredible amount of stigma. And with that stigma comes women not wanting to get care, because it's just so darn unpleasant, and avoiding care because of stigma. And that's where we really see problems in pregnancy. So that's one thing I really want people to know. And then in terms of treatment of substance use disorder in pregnancy, it's basically, with a few small exceptions, exactly the same as treatment of substance use disorder not in pregnancy. So pregnant people can have pretty much all the treatments that we would use not in pregnancy, and they often work even better than they do not in pregnancy because of slightly different motivations.
So I'm not a medical professional, but all of that was wonderful. I would just like to add that the most effective treatment is the one that works for that specific woman. So when programs try to dictate the treatment, that's where you see people who aren't having effective treatment. So if Suboxone is working best for this patient and she becomes pregnant, keep her on Suboxone. If methadone is working best for this other patient and it's working for her, we're not gonna change the course that's already working as long as it's safe for her and baby to take. And also with mental health treatment, it's the same. I've seen people who psychiatrists are treating someone's mental health, depression, bipolar, whatever, and then they become pregnant and they're like, let's immediately get off everything until you're not pregnant anymore, without having a discussion about risk and harm and weighing benefits and risk. And untreated mental health is not good for mom, and it's not good for baby, and it's not good for families. So you can treat mental health, you can treat substance use disorder during pregnancy, with very few exceptions, the same way as you would treat it without. And the patient has to have the autonomy to choose the best treatment that works the best for them.
You touched on this, but it's not informed consent if you don't have a choice. And I think that that's something that we remind medical professionals of, and we also, as people in recovery, especially Black and brown women and others who are able to get pregnant, really having an advocate if you're not able to do it for yourself, but it is not informed consent if you do not make that choice.
Thank you for making that point. Anybody that's not a part of the medical community want to talk about something you wish people knew more about in terms of treatment? Yeah.
I just wanted to say one thing. So when I had my son and my daughter, I was on methadone with my son and Suboxone with my daughter. When I was in the hospital with my son, the nurse told me that I should try to breastfeed him because it would lessen the likelihood of him going through withdrawals. And he only had to stay in the hospital 4 days. Usually the babies stay in the hospital 2 days, but they kept him 2 extra days because they had to observe him, and score him and make sure he was okay. And I did the same thing with my daughter. They actually told me that if she went through withdrawal symptoms, they were going to open up a CPS case, but if she didn't, they weren't, which seemed kind of crazy to me. But anyway, I breastfed her, and she didn't go through withdrawals either. So, and I know people that have had babies on methadone, and their baby was in the hospital for like months and months. So, I highly, recommend that if anybody is on those medications or anything else.
Thank you for sharing that. We're definitely going to do questions. Yeah. Afterwards. Huh? Afterwards, yeah. Okay. Okay, cool. Hold it and just let me know. Okay. So thank you. Would you like to interject about that at all?
I think I just want to say I recently had a mom. I think that it's important that all of the teams, your medical providers, work together, multidisciplinary teams. I had a mom, her OB was able to connect with her addiction medicine, who also connected with her LCSW. So they had a collaboration, which supported the mom better. She didn't have to wonder, with one person saying one thing, one person saying another thing. They all understood what her wishes and desires were and worked together to make sure she was safe and supported.
Thank you. Okay, so what myths and stigmas do you want to dismantle about pregnancy and addiction, recovery, or treatment for substance use disorder in the pregnant and parenting communities?
I think one thing we need to get away from is that if you're using or you're going through recovery, that you're a bad parent. We know that, substance use disorder is a chronic condition, and just like other chronic conditions, it needs to be treated. It's not something that someone chooses because they're choosing their addiction over their baby, or they want to use the substance more than they love their baby. I think we definitely need to get away from that. I've supported moms in the throes of their addiction, and they cared about their baby. As she said, the baby can be a very motivating factor for them. So I think that's something we definitely have to get away from.
One significant myth I want to dismantle is the idea that as soon as a woman discovers she's pregnant, she should simply be able to stop using substances due to the love for her baby. Unfortunately, it's not that simple. From personal experience, I know that in active addiction, the disease takes control. It transforms you into someone you don't even recognize, someone who tragically may sacrifice anything for the next fix. This disease is powerful, and it doesn't disappear just because of a positive pregnancy test. We need to replace judgment with understanding and support.
In addition to what's already been said, because those have both been really great, there's a myth that if we punish people more, then they're not going to use substances, which we know is not true. And especially when you factor in pregnancy and how much policing there is just around pregnancy in general, and when you add substance use to it, we get really punitive consequences. There are several states that can incarcerate women for the duration of their pregnancy based purely on the fact that they're using substances. Luckily, Virginia is not one of them, though anecdotally you do see that sometimes. So the myth that you can police or make laws that will prevent women from using substances during pregnancy is false, and we actually see poorer outcomes in states that have more punitive laws. So if a woman is scared to disclose that she's using substances during a doctor's visit, she's not going to get the treatment she needs. She's going to have poor outcomes. Baby's going to have poor outcomes because she's worried about incarceration or her children being taken away. So we need to offer support and understanding and not think that we can incarcerate our way out of this.
Yeah, that's like never ever worked for anything. Well, and I would just say, I feel like I already said a few myths I would want to dismantle, but just again, if we need to look at the actual science, the actual negative outcomes on both the pregnant woman, who is not a vessel, not just a vessel for a fetus, and also though the health of the fetus, because as a physician, we always think of ourselves as having two patients in this situation. And we do need to look out for both people, and we really want kids to have a good start in life. We feel very deeply about that. And I just want to share with anybody who, maybe doesn't believe this, or through their work it's hard to believe this, that usually the pregnant person and the doctor or whoever they're working with are on the same page. I have yet to have a person who's like, I don't want a healthy baby. I mean, everybody wants the same thing. And if you can know you both want the same thing, and you can explain your concerns that, you think a way to get to this common goal is this, often people are really happy to hear that. And things like an unconsented neonatal drug test, if there was a reason that they were concerned and they had brought it to you to say, hey, he's exhibiting this symptom, I know you said this, could I just 100% to be sure I'm not missing something, could I do this check? Maybe you would have said, okay, I said this, but if you want to be 100% sure we're on the same page, you could do that. I'm not saying you would have necessarily said that, but to understand we're all on the same page almost universally, and then use that common ground to kind of reach agreement and do care that works with the patient rather than kind of butting heads with them.
I appreciate that. Thank you. Well, and because I find that it's not so much the medical professionals, it's the ancillary professionals who are surrounding and not necessarily supporting the mother-baby dyad. I have a very, for me, I think the biggest myth is the overvalue of pee. Pee actually doesn't tell you whether somebody has a substance use disorder. It doesn't tell you whether somebody's going to be a good parent. It doesn't tell you, but pee will also get you thrown out of a recovery residence. It will get you your baby removed. It will, so get CPS involved. So pee does tell you something, but there's more that it doesn't tell you. And so being able to help people, I say unpopular things, but that's okay. I'm very real. And I've watched too many people. We have a woman who's going through it right now because she has had a positive urine drug screen. So helping CPS and the folks who work in social services understand that, just because she tested positive doesn't necessarily mean that her baby is at risk or is being neglected.
Or that her baby was even with her at all when she used.
Or that it's even going to hurt the baby. Again, the problem is with it being illegal and the social consequences of that. If we're really going to try to protect fetuses and use urine for it, we should just check everybody for smoking. And those are the people who should be locked up. Seriously, if we want to protect fetuses, that's where the most harm comes in, tobacco and alcohol. We're checking for substances that don't actually have a lot of consequences on fetal health. And we ignore the ones that have the most consequences. So it's not based in science, it's based in sort of stigma. And yeah, way too much urine. I'm gonna add on to your myth here, way too much urine.
That should be your takeaway. Way too much urine.
T-shirt, like the conference T-shirt. Yeah.
I just kind of want to chime in a little bit. I think more about kind of destigmatizing. I was, towards the end of my last pregnancy, really afraid of becoming a part of the statistic of the high mortality rates of Black women in childbirth. And postpartum, and even pregnancy. And I have preeclampsia, a pretty severe form of preeclampsia, which is like the leading cause of the mortality rates, right, in Black women. I kind of want to just dismantle kind of like this stigma around like trusting POC women, like in the medical community, and treating them equally to white women who give birth. If white women say, I'm sick, I need help, please, like, you know, help me, like, with this, or I feel like something is wrong and something needs to be done, we listen, you know? And I have yet to interact with a person who was non-POC that has had that experience. And so I think that that is something, and I know that my skin color had a lot to do with my treatment. And I'm not naive to that, and I see a lot of people nodding their heads right now, like I'm speaking to somebody. So I wanted to put that out there, that's very important. Okay, so we're actually doing great. We're doing great on time. Okay, so in your experience, what has the medical clinical community done well to support and treat pregnant women with substance use disorder? And then we have touched on what is some of the things that can be improved, but if there's anything else that you'd like to share, that'd be great.
I think sessions like this are very important. I think we are coming more from a non-judgmental, trauma-informed care that is supporting moms, erasing the stigma, allowing moms to be open and more truthful are very important. I think something we still need to do is more access to treatment and care. As she said, there's only one residential facility, I think she said one, where dads can come, and there's like two where moms can take their baby. Zero. So, we need to have centers, because why are we separating moms? Moms are in recovery, trying to support, trying to get through, and they want to be moms, but we separate them from their babies. How is that helping anyone? So that is definitely something that we need to work on and improve so that they can continue on their recovery journey.
I think that medicine has come a long way. I definitely prefer Suboxone over methadone. I just was so tired when I was on methadone. But I wish that there was more effective medications to help people with cravings that are addicted to stimulants like meth and cocaine. As far as I know, I don't really think that there's much to help them. And it's a totally different thing. So I just wish that there was more to support them. And also, I feel like everybody should be treated equally. I think it's really sad that that happens. I know somebody else that said that they only, they go out of their way to make sure that the people that are treating them are people of color too, so that, that doesn't happen. But I think that that's really sad. It shouldn't be like that. I remember watching Oprah one time, and she was talking about racism, and everybody that came in, she was like, everybody that has blue eyes is stupid. But it's like that. I mean, it's dumb. It's the same kind of thing, and I just think it's really sad.
The medical community has come a long way in the past, 10 or 20 years of understanding like addiction is a disease of the brain and it needs to be treated as such, and it has become less punitive. But it still has a long way to go, and a lot of medications aren't really tested in pregnant women because you don't want to test and have something that could be harmful to the fetus. So it takes even longer for medications to get approved for use in pregnant women, and because of that, there's just kind of like a lag in the treatment that they are able to receive. Yet they are, having a lot of legal and social consequences because of that. There's a lot more treatment on person-centered language, and there's a lot more learning about like how to speak to people and motivational interviewing and really getting people to be in charge of their own medical decisions and their own path in recovery, whereas it used to be very paternalistic. The doctor's going to tell you what to do. You're going to have to go to all these sessions. You're going to have to do this. So I think it has come a long way, but there are still a lot of medical professionals and counselors and systems that are set up to kind of dictate the treatment instead of offering treatment and allowing people to kind of choose the path that's best for them and their families. So we've come a long way, but there's still a long way to go.
Yeah, I'll just echo what everybody else said. Still a lot of progress that needs to be made. I personally would also like to see, as well as what other people said, more support for the fourth trimester, the few months after birth, and more support for men. Like you said, I have several, single dads who have newborns who need support and can't get it. And also I treat transgender men, and I've had several transgender men who have gone through pregnancy, and they're not necessarily, wouldn't be comfortable in a space that's all kind of women. So I would add those services on as something that we need.
I agree with everyone. One of the things that I'm seeing in Virginia that I'm excited about is the number of peer providers who are becoming part of the team, who are delivering services. So the recognition, the fact that people are recognizing that we bring tremendous value to being part of the team, I think is we've come a long way with that. And being more informed by people who are in recovery who are also parenting. Folks are being allowed to sit on committees and making decisions, or at least being at the table, whereas they weren't before. I also appreciate the fact that you two are here as allies. I think that's one of the biggest pieces that I've seen change is the number of champions. And so I am grateful for both of you.
Okay, so we are on our last question, and then we're gonna do Q&A. What message do you want the audience to take away from this panel discussion today?
So I think that, as you said earlier, it's really isolating. I think society, we have become very isolated, especially after COVID, right? Everybody's in their own silo, doing their own thing. But we need each other. We need a community, especially during pregnancy. Someone said pregnancy's hard, recovery's hard. So pregnancy and recovery is super hard. So we need to build each other up. We need to have a good support system in place so that we can survive. Also, as a doula, what I always tell any mom, whether they're recovery or not, you're worthy of it. Not because of who you are, what you've done. Your past does not dictate what you are able to do, right? You are worthy right now just because of who you are. So you're worthy to have the birth that you desire. You're worthy of a healthy baby, and you're worthy not just to survive, but to thrive in your life. And I think that is just so important. So with my doula clients, I do affirmations, and that's one of the first affirmations that we do. I am worthy. So I think everyone should just really hone in on that.
The key message that I want to convey is that recovery from addiction is a deeply personal process, and it's rarely linear. Not everyone gets it right away, and that's okay. People struggling with addiction often cannot stop on their own. While asking for help is hard under any circumstances, the immense stigma surrounding pregnant women with addiction makes it exponentially more difficult for them to reach out. My hope is that we can work together to dismantle the stigma. Addiction is a complex mental illness, and those who suffer from it are in profound pain, often compounded by other mental health issues they may be attempting to self-medicate. I believe it's crucial to find the right combination of medication and therapeutic support to stabilize individuals. The stigma attached to addiction forces many to suffer in silence, sometimes for years, until their lives spiral out of control. If we can create a more compassionate and understanding environment, perhaps people, especially pregnant women, will feel safe enough to ask for help sooner. Early intervention is critical for both the mother and the baby, increasing the chances of a healthier outcome and a brighter future for all.
I started by talking about how the systems are really not set up for pregnant women. And I think that that's one of the big things that needs to change. When women don't have childcare, when they don't have programs that will accept them when they're pregnant, they don't have programs that will accept them with children. Men don't have programs that will accept them with children. That's keeping people away, and that's not offering people the support that's best for them. So focusing on the systems that we interact with and systemic change so that we can provide low barrier treatment for people without IDs, people who are asking for help, but the systems are creating too many speed bumps for them to be able to access that help. So focusing on low barrier treatment so that people can get the help they need when they want it. And I think that that's when we'll see more change.
Yeah, just I guess my takeaway, as well as everything that I said, I feel very strongly about everything that I said, but the one that I feel most strongly about for medical professionals is that pregnant people are awesome, and it is the ideal time to intervene in terms of substance use disorder. And I know this is something from my personal experience, personal change in the service of a healthy pregnancy is somehow much easier than personal change other times. So it is the perfect time to work with people and the perfect time to get help if that's something you've been thinking about for a while but haven't quite been able to do.
Pete, no. So certainly I stand by everything that I said as well. And one of the things that Nora Volko, who's the head of NIH, taught me many years ago about this population, in encouraging me to do the work that I'm doing now, is that people who use substances, as well as people in recovery, have every right to have families. And so I think that's my message to leave with all of us.
Yes, okay, so now we are definitely open to questions. Please, folks on Zoom, I want to engage with you, and so if you have a question, we'd love to answer it. Okay, as of now, we don't. Okay, so, yes.
Hey y'all. So I lost my son 6 years ago. I've been in recovery for 4 years as of March 3rd this year. And I just gainfully got full custody back of my son on April 23rd. I know as a peer recovery specialist that our story can really be a lifeline to others and their success in life, but it isn't always a lifeline to them. So my question to y'all is, how can I help give meaningful hope and encouragement to women who are mourning the loss of their child and is struggling with how long the unification process can take?
Great question, okay, yeah.
So I think education, right? There's specific training. We're working with the Commonwealth of Virginia to set up, much like there's forensic peers and there's other kinds of particular peers. We're asking the Commonwealth of Virginia through the Virginia Department of Health to create peers whose area of expertise is in supporting pregnant and parenting people. And so I think taking that training for peers, we're training doulas, we've trained a lot of folks, but because it gives you the science behind what it is and also allows us to use our lived experience as appropriate, but not in ways that are harmful. So I would encourage you to find some of that training.
And there are more institutions who are hiring peers for that peer support. I know VCU Health has been focused a lot on hiring peers. They're embedding them into the hospital so doctors can put in consults for them. They can go and visit with people who are, in their addiction, and then can be visited bedside by somebody who can offer that lived experience when they go through trainings like peer recovery support and things like that.
I feel like as long as it's still, their rights haven't been terminated and it's still possible for them to get their children back, you sharing, your experience that you pulled it together and you were able to get custody, that will give them hope. I think hope is a big thing, a big motivator.
But I figure it's April, Second Chance Month, and I may
So there's going to be a summit in December, a statewide summit, and I would love for you to participate on the fishbowl if you'd like to, and then you'd be able to provide a lot of education for all kinds of different layers and levels of people who will be there.
I want to thank you all for a wonderful panel. First, a statement, and then it'll lead into a question. So I know of about 4 different recovery community organizations in the Commonwealth right now that are offering parenting houses for women with a child. Why is the system set up right now to only accommodate 1 child, though, in most cases? Because there are no systems that I know of that accommodate the family of children. It's just 1. And how do we create a system that's less of a Sophie's choice kind of punishment for the mother and the children?
Money, I would say, is a big one. You know, I know one recovery house that it's a child under the age of 5, because they're thinking about logistics and insurance and how are they getting the kids to school if they're older and things like that. And there's not enough space because now you need multiple bedrooms. So funding, grant funding, community funding, opiate abatement funding, those types of things, I think is really what's holding a lot of that back, personally.
I know there is a program through RBHA that I don't know, like, if they still have space, but they, through, like, treatment there, they're inpatient. Women with children, they help them find a house and, pay their rent. And I don't know how long, it's available to them, but I know some of those girls had, 3 and 4 kids, so.
Hi. First, I would like to just say thank you for coming and sharing your wisdom and knowledge with us. But I really want to thank you, Rachel, because I know it takes a lot to come and put it all out there, and I want you to really, really, really be proud of yourself. As a mother with a child that has gone through recovery time and time again, and I'm the grandparent that had to start all over again, raise 3 kids, what would you recommend to me to support that child? Because honestly, I'm really angry at them, and I think it comes out a lot, but I know they're struggling with recovery. So what would you recommend a person to, say, a mother like myself?
So your child is struggling with being in recovery? Is that?
Yes, he's in recovery now, so he's actively in recovery now. But it's been a journey, and it's been kind of back and forth. So as a mother, it's like, okay, can't let my guards down, because you never know when it's going,
I mean, that's hard. You can't force somebody to be sober, but I know that it's scary because people are, going out left and right. I think that if he finds something that, like a hobby that he's like, that motivates him, or something, he needs something positive in his life, something to motivate him. My daughter was it for me. I don't know if he has kids or, yeah.
And I know Jan's going to jump in, but first panel of the morning, tomorrow at 9 o'clock, is pairs of family members that have their own recovery journeys. So it'll be totally focused on that topic. But go ahead.
Yeah, and I know that in Maryland, they're doing a really good job. They have an academy, and so we're trying to get one down here as well, that provides education and support for folks who are in your exact situation. And some of it is learning the science and learning, all about what it takes to be in recovery, because that helps us have a little bit more compassion. And I think the final thing is it's okay to be mad. That's real. that it's okay to be mad.
I also wanted to say, my mom has struggled. She's been in and out of recovery for years and years, and they say that having a relationship with God is a big part of recovery and staying clean. That you don't have to, but that it really helps a lot. And I do have a relationship with God. My mom's an atheist, and I don't know if that like played a part, you know, with her not being able to stay sober. I just wanted to throw that out there.
I mean, can I just add one thing? And I'm talking to you because you asked the question, but I don't know if this is relevant to your situation. But just to put out there too for family members, and it becomes really relevant for people who are pregnant, and then often they are depending on some family support. The idea that you have to somehow kick people out, or you're an enabler if you help them, or you can't both be supportive and mad at the same time. I think we need to kind of get rid of that. Like, you can be both supportive and angry, that's okay. And actually continuing to love and support people is much more helpful than trying to teach them some kind of lesson, you know, by withdrawing your support. And so you have to draw your own boundaries. You can't allow someone to hurt you and torture you, but you don't have to withdraw support from someone that you love, who you want to still help, out of fear that somehow you're making the addiction worse or you're enabling them. So just to stay as present as possible for a person who you are trying to help, especially in pregnancy when that connection is so important, is just, I just really, that's another myth I want to bust. It's not really about pregnancy, just about family relationships.
Yes, and just to highlight, so these sessions are all recorded, and many years before this, sessions were recorded. And in fact, last year at this conference, Jan did a full day training on family support that is live on our website. And so on the YouTube page for the conference itself. And so that is a really wonderful place for folks to start in terms of family support, because we have a lot of good starting points for family members, but we don't do a good enough job serving family members. So.
Thank you.